Now, the fight against the HIV virus has made a lot of progress over recent years, but new research published today has detailed an outbreak on the streets of Glasgow of a scale not seen in the UK since the 1980s. Homelessness and the sharing of needles by cocaine users are cited as the key factors behind a tenfold rise in infection. More than 100 new cases of HIV were identified between 2015 and 17, and the surge has been linked to a sharp rise on cocaine injecting among Glasgow drug addicts. Courtney Cameron has this report.
1 o'clock this afternoon in the centre of Glasgow.
It's a user, and this is what you're seeing now in a daily occurrence every single day. Something has to change.
Alex is homeless and has been using drugs for 19 years.
HIV is spreading like wildfire. I've lost 7 friends in the last 5 weeks just by dragging cocaine.
Research shows the number of people injecting drugs who have HIV has increased in Glasgow city centre. More than 100 new cases of the infection were identified between 2015 and 2017. But contracting HIV isn't always at the front of addicts' minds. Michael started using drugs as a teenager.
5, maybe 10 people sitting or using the same needles.
So you've been in situations then where you've seen 10 people all using the same needle?
No, the same needles. No, not just one, but just a couple, but everybody's using them.
Health workers say over 90% of the people diagnosed as part of the outbreak are now getting HIV treatment.
So we expanded the provision. We had opened out-of-hours provision. Now we replaced the central with the central station pharmacy with a mobile van, and we're looking to actually open the supervised drug injecting facilities, the heroin-assisted treatment, but also we changed the way we treat people that have HIV in a way that it's easy for them to access.
Experts are hopeful the research will provide further justification for a safe drug consumption room in Glasgow.
We reflected on the findings with Glasgow Caledonian University's Dr. Andrew McAuley, who was lead author of the research study, and Kirsten Horsburgh, who is the strategy coordinator for the Scottish Drugs Forum. Andrew, how do you explain the massive spike in HIV cases?
Well, there was an HIV outbreak identified among people who inject drugs in Glasgow in 2015, and our research has shown the impact of that outbreak on the population prevalence of HIV among people who inject drugs in Glasgow. And what we've seen is that the prevalence has increased from less than 1% to over 10% in a very short space of time. And this is the largest recorded incident of its kind in the UK for over 30 years.
And why in Glasgow then?
Well, again, our research has looked at the drivers of HIV infection in Glasgow, which have characterised this outbreak. And what we've identified is that the strongest drivers of infection are cocaine injecting and recent experience of homelessness in the city.
Kirsten, how much awareness is there amongst people that are using drugs about HIV?
Well, I think when the first cases were identified in 2015 as part of this outbreak, it had probably become one of those things that had been slightly forgotten about. People were quite heavily aware of the risks of hepatitis C, for instance, and it was almost like HIV hadn't been a thing for quite a number of years, and it maybe wasn't on people's radars. But not only that, for people who were actually using drugs and injecting drugs themselves, but also from staff as well. So there's been a lot of work done with staff to make sure that staff are aware that HIV is still a risk factor, and that they are giving out the right information and making sure that people have access to testing.
And what are the prospects for those people that get HIV then?
Well, if people get tested and it is identified that they have contracted HIV, if they get access to treatment quickly, then absolutely their prospects are pretty good. There is no cure for HIV, but if people are receiving treatment, certainly they can live long and healthy lives with HIV.
But I suppose the problem is that a lot of users have got very chaotic lifestyles. How do you get to them to diagnose them, and then how do you get them to keep taking the treatment? That's the part of the problem, isn't it, Andrew?
Yeah, so that was one of the challenges early on in the outbreak, was to try and identify mechanisms to test as many people as possible and to get as many people onto treatment. The HIV treatment model was traditionally characterised as a hospital-based model, That has been completely remodelled in response to the outbreak by the Health Board, and HIV treatment has been taken into the community where people can access it at the point of need.
And that makes it much easier for them then?
Yeah, it makes it much easier for them to access treatment and consistently comply with their treatment schedules. And we've seen now that over 90% of the individuals diagnosed as part of the outbreak are now engaged in HIV therapy.
All right. Because of this spike, I mean, you've got the mobile needle exchanges out there, and you've got support in the community, but that's obviously not enough. It's not working, is it? What else needs to be done, Kirsten?
So back in 2015, there was a health needs assessment done among people who are injecting in public places in Glasgow city centre. And that highlighted a number of recommendations that were needed to improve existing services, but also the introduction of new services. Two of those new services were for a safer drug consumption facility and for heroin-assisted treatment. So heroin-assisted treatment will go ahead later this year. The plans are already in place to start that. So that would be a facility where people would receive prescribed diamorphine and inject that diamorphine under the supervision of staff. The safer drug consumption facility is not yet legally approved for us to be able to introduce.
The Home Office has said that they won't allow that. There's no legal framework for the provision of drug consumption rooms in the UK, and we have no plans to introduce them. I mean, how helpful would it be to have the consumption rooms, and why would that be more effective than the other room?
Well, it shouldn't be seen as kind of one or the other. Both proposals were put forward as they were proportionate responses to the situation we were observing in Glasgow. They've been described as radical, but we certainly wouldn't view them in that way. There are over 100 safer drug consumption facilities across the world, and they are proportionate responses to where we have large populations of people injecting in public places, suffering severe levels of harm and even mortality.
I mean, as a layman, it seems to me that there isn't a huge difference between the two ideas. Do you think it's maybe just a matter of time before the consumption rooms are introduced? Because you think, obviously, there's a very real need for them.
There's a huge need for them. It's a pragmatic solution to an absolutely devastating situation that they're faced with at the minute. And like Andrew said, this is nothing new. Safer consumption facilities have existed for over 30 years. It provides a perfect opportunity to engage with people who don't normally engage with traditional services. So it is absolutely still necessary. We already provide people with sterile injecting equipment. Providing people with a sterile environment in which to use it just makes absolute sense.
But can you understand why, some members of the public might be quite worried about that? People almost legally taking Class A drugs.
Yeah, I can understand it, but the success of these facilities are usually when they're embedded in areas where public drug consumption is already taking place. So these people living or working in these communities are experiencing public drug consumption on a daily basis. So this will not just benefit the individuals who are consuming the drugs, it will also benefit local communities as it will move that drug consumption away from the streets and into a safe, sterile environment that Kirsten highlights.
Okay, well, we'll have to leave it there, but thank you both very much indeed for joining us this evening.
Thank you.